So, hello to everyone. How are you? I'm David. Due to being found positive to COVID-19, I've been put into quarantine for 10 days till I recover. I'm feeling excellent. I'm asymptomatic, but I found this will be an opportunity to once a day give a 10 to 15-minute short lecture on certain topics of scalp acupuncture or other case studies from my practice and more. So this is the first one in a quarantine, I call it Quarantine Plus webinars. So you can join us every day at 12:30 p.m. Israel time, which is Greenwich Mean Time +2. So for example, in the UK, it would be around 10:30 in the morning. Spain was probably also about 10:30 in the morning. Greece will be the same time zone, and the United States, West Coast, will be about 7 hours behind us. And West Coast will be 10 hours behind, and East Coast would be about 7 hours behind. So with that, I'm going to start with our first topic. Is actually 3 points, actually it's 6 points, but that you can use in your clinic that are very, very useful in treating thoracic, cervical spine disorders, thoracic spine disorders, and lumbar spine disorders, such as could be pain or musculoskeletal problems in that area. These are updates from 2018 of Dr. Toshikatsu Yamamoto. And they're very, very useful and very, very easy to use. So you can immediately start applying it today in your clinic, even if you have a clinic later on in the afternoon or later on in the day, or even tomorrow if you only observe this webinar later on. So moving to the location of the point. So as we can see, the points are located on, as we can see here, what we have, the letters that stand for, we have LS stands for lumbar spine, TS stands for thoracic spine, and cervical spine is CS. So as you can see, all these 3 points or 3 areas of needling, these are needling points, are located right in the frontal area. Okay, if you can see, they approximately located in between the area of bladder 2 acupuncture point or bladder 3 acupuncture point, right in the forehead. So first of all, we need to locate 2 basic points of Dr. Yamamoto that are very, very useful for treating also cervical spine and thoracic spine. The first point is what you can see here is A point. A point treats any disorder of the cervical spine and the head. Okay, and the thoracic, and E treats the thoracic spine. Okay, the upper part of A area, which you see up here, will treat is around the head, cervical 1, and the lower part, which you can see here, is cervical 7. So all the areas in between are those areas in between in the areas of the neck. What we see here, which is E in red, the lateral part of E is actually T1. Okay, and the medial part is T12. So all this area can be treated in the thoracic spine, but it's not only A and E do not only treat the musculoskeletal system or the spine itself, but also the organs located nearby. For example, E will not only treat the thoracic spine and the muscles in the upper thoracic area, but also can treat cardiovascular disorders, pulmonary disorders, esophagus disorders, and etc. Where A point will not only treat, like I said, the cervical spine and kinetic disorders of movement of the neck, but also the thyroid glands, the vocal cords, the epiglottis, the sensory officials here in the upper area, and extra. So first of all, we need to locate these 2 points. So the location of the point, A point, is located on the anterior hairline. The natural anterior hairline is actually where the natural anterior hairline is, where actually the occipital frontal ligament would meet the frontalis muscle. As you can see here in the image, you have the frontal occipital ligament meeting the frontalis muscle. Okay, that's going to be actually the natural hairline. So if I would come closer, for example, and I'd raise my eyebrows, you could see where my occipital frontal ligament meets my frontalis muscle. So my hair is receded up backwards, but actually my natural hairline when I was younger was located about here. Okay, so that is going to act as our hairline. So A point is a 2 centimeter vertical line which is located approximately 1 centimeter lateral to the mid-sagittal line and starts from 1 centimeter into the hairline to 1 centimeter below the hairline. Basically, this A line sits very, very close to bladder 3, okay? Bladder 3 is the center of the point. That's going to be actually cervicals 3 or 4 area, plus minus, okay? Now, it's not that when you needle, just like in Chinese scalp acupuncture, you thread the needle through or thread it downwards or posterior. Here you look in palpation. When you palpate, you look for the most sensitive point, and that point will be needle, the most sensitive point. The needle is inserted into there, okay? Then we coming down to E point. E point is located actually in the area is a 15-degree, 2 centimeter oblique line, which starts from approximately gallbladder 14 point, okay, and goes inwards and finishes inwards about half a centimeter to a centimeter above bladder 2, okay? That, or actually it sits in what is called the superciliary ridge. It's this ridge or crest that just sits above the eyebrow, okay? So the lateral part, which sits right in the pupil line, is going to be T1, and the medial part is going to be T12. So these are what we call the A basic point and B basic point, okay? In general, they needle, if you don't use the diagnosis, you can use them ipsilateral, they needle, okay? Now we go into the thoracic, lumbar, and cervical spine, okay? If you can see here, if we take an equal distance between the inferior border of A to the medial border of E, there's no points that are located in the middle. But if you go a bit anterior to here, okay, in that, and you divide it into equal distances, okay, we're going into the medial part here, equal distances, slightly medial to the line, we have lumbar spine, then in the center, thoracic spine, and then cervical spine. And then slightly lateral to that line that is accumulated between A and E, and slightly above, in between that meeting point of the lower body of A and E and lumbar spine, you have another lumbar spine, then you have thoracic spine and cervical spine. Before you needle the first of all, when you treating the patient, first you needle the medial parts, okay? For example, if I'm having lower lumbar spine pain, okay? First of all, I'll needle the medial line. So I have lumbar spine 1, which will be this one. I needled it. If I see it improves, but I still want more improvement, then I go to the lateral part. The same will play for thoracic, which will be 1 to 2, cervical, which will be 1 and 2, okay? So we'll go and draw them out so it'll be more understandable. So I'm having this image here, okay? So I'm going to the image. Let me open up my drawing board. Okay. We'll use black in this case, because black, I actually want to draw basically first my natural hairline. Okay? So the natural hairline will be approximately here. If I would ask my friend here, Avi, to raise his eyebrows, it'll be approximately here, where, like I said, the frontal occipital ligament will meet the frontalis muscle. And this would be approximately my mid-sagittal line. Okay? So A point. A point will be located, it's a 2 centimeter vertical line that starts from 1 centimeter into the hairline to 1 centimeter below the hairline. Okay, that's A. E point will be that oblique 15-degree angle line. Okay, so that's bladder 2 about, and that's bladder 3. So you have this area in between. Okay, now just so we have an idea, I'm going to draw a line which is connecting between the two. We know lateral and medial. Okay, this is just an imaginary line. Okay, and now we need to locate in equal distances the cervical, thoracic, and lumbar spine. So we'll make my line a bit thicker, use blue. So like I said, in equal distances between the cervical spine, lower body of A point, and the medial border of E, in equal distances a bit medial, I'll have lumbar, thoracic, and cervical. So 1, 2, 3. 1, this will be 1, 1, and 1, okay? But it'll be cervical, it'll be lumbar 1, thoracic 1, cervical 1. And then a bit slightly between, a bit lateral, okay? A bit higher up to that line, we have thoracic, lumbar, thoracic, and cervical. So you can see that in equal distances between 1 and 2, where first of all, like I said, you needle this line, okay? Will be the medial line is needled first. And the second option afterwards, number 2, as we can see here, is the lateral, okay? This will be again, lumbar spine, thoracic spine, and cervical spine, okay? So these are these needling points. Now, if you want to go deeper into using these points are needled, they need to be tender as well. At the same time, when you're putting pressure on them, you can ask your patient to see if he has any improvement in that area. For example, if I'm having lower back pain and I palpate and put pressure on the area of the lumbar spine, number 1, ask the patient to move. If he says it's better, then I needle that point with palpation. But these points, if you want to go deeper into them to know which to needle, if to needle on the left or to needle on the right, also have a diagnostic area. The diagnostic area is actually located on the second metacarpal bone, okay, around large intestine 4. So we'll go into the diagnosis. Okay, as we can see here on my image, on my left side, we have the metacarpal bone, okay? We have the meeting point of the metacarpal phalangeal number 2, and the metacarpal metacarpal, the edge, the area of where the joint here meets. Sorry, I forgot the name, where the metacarpal 1 and 2 would meet, okay, that joint. So right by the bone, okay, medial to the bone is going to be the area of the brain, which we're not discussing, but we actually need the lumbar, the cervical spine, thoracic spine, and lumbar spine, where the metacarpal, the meeting point of the metacarpal bone and the phalangeal bone, where the joint where it meets, that's going to be the lumbar spine. So in equal distances, approximately between the area of the edge of the bone, okay, closer to me, of the bone, you have in equal distances, you have thoracic spine and cervical spine, okay? So if I would draw it out here, again, go back to my drawing pad. Okay, we're going to use this. So if I have here a joint, here a bone, and here another edge of the joint. Okay. So then in equal distances, I would have right here by the joint will be the brain. Okay, but we're not interested in that right now. We would have cervical, thoracic, and lumbar, which will be right close to the bone. So according to where it is sensitive here, I will needle the point on the area of the forehead. After I've needled that area on the forehead, I will go back and see if the sensitivity here is lessened. If the sensitivity here is lessened, it means I've needled the point correctly and in the correct manner and correct way. And at the same time, I will see the patient's symptoms disappear. So all this, here is a video so you can see how the palpation is done very delicately and very softly. You can palpate both sides bilaterally, and according to which side is more sensitive, that is the side where you apply the needling points. For example, if my left hand is sensitive, I will needle any one of the points on the left side according to the specific area of diagnosis in my round large intestine 4, and the same will be on the right. So erase the board. Sorry. And go to video so you can listen to the video, how the palpation is done. So what we can see, you have the metacarpal bone, which I'm pointing out here, the metacarpal bone. Okay. The proximal and the distal area. That's the distal and the proximal. So right by the proximal area of the joint, that's going to be the brain. Slightly below will be cervical, then thoracic, and then lumbar. Actually, the big part of the belly of the muscle here is going to be the cervical, is going to be the thoracic. So as you can see, the palpation is done very softly. It's from medial to anterior, to underneath the bone. As you can see, I'm palpating very softly here. And where I discover that's lumbar. Lumbar, okay, so cervical, thoracic area, okay, and lumbar area. Which area is sensitive, I will needle accordingly, and afterwards in the palpation, sensitivity will subside and improve. So this will give me the correct side which needs to be needled. Okay, and what I want to show you that I'm palpating from medial part of the bone muscle to the lateral part of the muscle. So that was our talk for today on these specific points that are very, very useful for treating thoracic, cervical, thoracic, and lumbar spine, which are diagnosis around Hegu point, large intestine 4. Hope you can use it in your clinic and found it very, very useful. If you wish to contact us, if you wish to contact me, this is all my contact information. You can contact me by email or visit our website where we have more and more information. So thank you very much for coming and listening to this, and hopefully see you tomorrow at 12:30 p.m. my time.